time to move to our next guest. We're pretty excited about that. As we talked earlier, Brent, decision support, utilization of data, and enabling consumers to make better decisions on healthcare is very important in this space. And joining us to talk about that and what they're doing is Adrian Rawlinson, Chief Medical Officer and co-founder of Obeo Health. Adrian, good morning.
Good morning, gentlemen. How are you?
Fine. How are you? How's San Francisco this morning?
It's a beautiful sunny morning here, as is every day virtually.
Well, Adrian, we really appreciate you spending time with us today. Give our audience a little background on Obeo Health, please, and your origination and where this idea came from and what you guys are doing.
Sure. Well, thank you so much for having us on the show. We really appreciate it. We're a relatively young company based out in the Silicon Valley area on the West Coast here. We've been in operation now for about a year or so, and we have a pretty expansive, talented team of engineers, designers, big clinical clinical team here. And, we realized when we got together a while back that there were some, major pain points that the consumers have around healthcare. We started to dive into some of the numbers that we're dealing with here. And as we all know, healthcare is a $2.5 trillion business, and certainly costs, healthcare premium costs have increased phenomenally over the last 10 years or so. I think one study from 1999 to 2009 revealed that healthcare premiums had gone up 131%, whereas salaries over that time had gone up on average about 38%. And so, because of these rising healthcare costs, we realized that, this has become unsustainable for a lot of employers. Businesses are forced to increase deductibles to keep healthcare costs under control, and employees are more responsible for sharing in the costs these days. There is a big shift to place a lot of the burden on the employees. And so consequently, they do have more skin in the game, if you like. And we realize that there's a lack of tools out there to help people, to help employees in particular, make good decisions around various aspects of healthcare. And so, for instance, how do you select a medical insurance plan? How do you select an appropriate provider? How do you manage your medical bills? You and I, and I'm sure a lot of the listeners will probably have received those crazy sort of EOBs that we get in the mail. I mean, when I receive mine, I just can't fathom out what's going on. I probably just shred them or bin them, to be honest. So they're very difficult to understand. The concepts of co-insurance, co-pays, deductibles, high deductible health plans. What does this all mean? So we decided to approach this from a sort of big data perspective, if you like. What we do is we aggregate several different data streams. We work primarily with self-insured employers. We obtain, as I say, all these different data streams and are able to harmonize them, bring them together, and do a lot of slicing and dicing of the data, if you like, and then present that data to the end user, which is the employee. Allows them to look at specific costs around premium costs, out-of-pocket costs, and allows them to forecast what their future costs may be. So to give you an example, when open enrollment comes around, employees are faced with several different choices to make as regards different health plans. They may have HMO on offer, a relatively expensive PPO. They may have what is becoming more popular, a high deductible health plan that's tied with a health savings account. They may have in our area, Kaiser Permanente is a big player. So we have several different plans to choose from. And the old-fashioned way of choosing a plan is basically to look at that summary plan document that's provided usually by the Human Resources Department and it gives you a whole bunch of information about co-pays, deductibles, co-insurance, and no one can really figure it out. And so most employees just pick a health plan either by word of mouth, or they keep the same plan that they had in the previous year, and they want to get through that enrollment process pretty quickly. A lot of people don't spend much time on that decision, and it's a major decision. It's a major financial decision for a lot of people. So what our tool does, or the first module in our tool, I should say, what that does, it portrays all the data in a very easy-to-use, readable format. The user would log in usually via a human resources portal. It's a single sign-on solution. And we show them all their historical costs, and we extrapolate that data, project it forward, and show them what their costs are very likely to be in the future, depending on which plan they pick. The immense benefit for the employer is that what we've seen is a large shift to the high deductible plan option. Once employees see true financial data and can relate that on a personal basis, they realize that there are a lot of cost savings to be had by signing up for a high deductible health plan. Now, it saves money for both the employee and the employer, and we've seen shifts, from around 10-12% of high deductible plan uptake to around 40% using our tool. The second tool that we have, the second module that we have, as I alluded to earlier, is the concept of displaying that EOB, that explanation of benefits, in a very easy-to-read format. I can follow my costs day to day, month to month, over the space of the year. I can break down my costs by disease state, by a family member, by provider. We explain in really easy-to-use terms, what does it mean to have a visit with a physician? Where does my money go? How much do I owe? What's my co-insurance? Where do I lie in my deductible? So all this information is presented to the employee, and we hope, when they have access to personalized data like this, that it really drives engagement. It drives employee engagement, and as a consequence, they can make more informed decisions around these very important healthcare choices, if you like.
So Adrian, your tools are helping them make a more informed decision to better manage costs, but also making an informed decision on how they manage risk for their family as well, correct?
Exactly. So, we can look at each individual family member. We've built some very cool sort of intellectual property around the clinical side of the tool. We're able to cost out chronic disease states. How much does it cost for my son's asthma treatment? What would happen if I switched my son from a very expensive branded drug to a generic drug? Where can I get care as regards a cost-effective, good quality provider? All these, really important decision points particularly when we're managing chronic care, and we're able to sort of separate the chronic care from the acute care. One of the really interesting things that we've been able to do is give the end user the ability to customize the tool a little bit, in the fact that they can play around with different scenarios and then compute the costs accordingly. So to give you an example, we allow people to plan for future care. So let's say I'm planning on having a hip replacement, or maybe my wife and I are planning on a pregnancy. We give the end user the ability to add those in and really, figure out what their costs might be for the following 12 months.
Adrian, do you have plans, or are you doing it right now to provide kind of that third step and helping them find the right care for the right price in certain areas of the country, or
exactly? So the the next module that we're about to release is all about finding care and picking an appropriate provider. We've done a lot of work around displaying quality metrics and cost, relative cost of providers. We do that on a local geographical basis, which I think is incredibly helpful for the end user. So yes, we are moving in that direction. We also have a couple of other projects on the go surrounding adding data to the tool. Right now, we are primarily using data streams such as claims data, pharmacy data, eligibility data, etc. But we have a pretty unique way whereby we can bring in clinical data into the scenario. As a lot of the listeners will probably realize, is claims data is incredibly useful. It does have a few drawbacks in that there are some data gaps occasionally, and that can be filled in by marrying up that data with true clinical data. I don't want to say too much about that because it's kind of a little bit of a secret sauce that we have to be able to do that. But I think ultimately, once we have that complete data set, then we'll be able to run some very cool analytics against that, with a view to pointing out things like, for instance, billing errors or erroneous bills. As you and I know, the whole concept of fraud, waste, and abuse in the healthcare system is pretty rampant. I think if you look at the numbers, the Economist produced an article a few months back and computed the dollars to be about a $275 billion problem. So hopefully we'll be able to address some of those issues as well.
Adrian, I really like what you guys are doing, and we're coming up to the end of this program, and I always like to give our guests an opportunity to leave our audience with 2 or 3 clear takeaways.
Sure. I think what we've realized is that portraying personalized data to the end user really engages them in their healthcare, helps them to make better decisions. The technology now is available. The data is available. We've been able to use that in a very constructive way that not only helps the employees, but is also a huge value add to employers.
Hey, Adrian, thank you so much for joining us on the program today, and I would love to have you join us at any of our events throughout the year. I think you'd benefit greatly from them. But have a great weekend out there on the West Coast, and we really appreciate you joining us today.
Thank you so much. Have a great day, guys.